Joining us now is Dr. Richard Besser, the former acting director of the CDC, now president and CEO of the Robert Wood Johnson Foundation. Dr. Besser, good morning.
Good morning, Savannah.
What do you make of this action by the CDC? There's a very small number of myocarditis reported in adolescents and young adults. What red flags does that raise for you?
Well, first, it tells me that the system is working. There's an independent advisory committee that is monitoring safety data every week, looking for any potential signal that there could be a safety issue from the vaccines. And in seeing these cases of myocarditis, which is an unusual, rare inflammation of the heart muscle, what they're saying is, well, is this more than we would normally expect to see? Because this is, unfortunately, a condition that you can see in children and in adults. And so far, they're saying no, there aren't more cases than we would expect. But we want to make sure that there aren't some out there that we've missed. We want to make sure that there is no connection. So they're gathering information, they're gathering data to make sure there's no situation that they need to be worried about in terms of vaccines and myocarditis.
And I just want to underscore that because we don't know if there are any more cases of myocarditis than there would have been whether you had a vaccine or not. And we don't know if there's a cause and effect yet. We don't know if it's just a correlation or if it's really causation.
Yeah, I mean, this is one of the most challenging things whenever there's a new medication or a new vaccine to tell, is something caused by it or is it something that you would just normally expect to see? There are a lot of different viruses that can cause myocarditis as the warm weather comes. That's when we tend to see those viruses. There's also drugs and other inflammatory conditions that can do this. So you would expect to see a certain number, and they're seeing that number, but some of these cases are in that time frame after someone has received a vaccine, and they want to make sure that isn't just coincidence and that none of these were caused by the vaccine itself.
Well, Doc, you're a pediatrician, and you know there are parents who are watching this and going, okay, well, wait a minute here. I'll just hang out and wait. Who knows? This causes me concern. Maybe I just won't have my adolescent get the vaccine. What would your advice be?
Well, I mean, my advice would be there's something we do know. We know that COVID infection itself can be very serious and that we've lost hundreds of children and thousands have been hospitalized. So even if there is a connection with the vaccine, and right now we don't know that there is, we do know that COVID infection itself is much more serious than that. And so I would recommend that parents go ahead and get their kids vaccinated. There were 600,000 children between the ages of 12 and 15 who got vaccinated last week, which is terrific. You know, I think it's a sign that our children, or at least our children older than 12, will soon have the same protection that so many adults have.
All right, Dr. Richard Besser, thank you very much. Appreciate it.
Thank you, Savannah.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.